My name is Dimakatso Cynthia Ntleleni. I'm the Assistant Director of Health Promotion and Communication for Sedibeng District Health.
What is happening here today?
Today what is taking place here at our district, it's vaccination. The people that you are looking at, it's 60 years and above. If they have not yet registered, what we do, we have our data capturers on site which register them, so they need to bring their ID with. But beside our elderly people, we are also looking for our traditional practitioners, which are our sangomas, and people that work for funeral parlors, because they are regarded as essential workers at the moment. So they also need to bring in their ID, and they also need to make sure that they have the correct address and the correct cell phone number. Reason for that is that immediately when they register you on the EVDS, you need to give correct information, because the message goes directly into your phone. So it's important that when they come, they have the correct documentations. And we also are registering our previously healthcare workers which did not register during the Sisonke campaign.
Tell me, I'm getting some people who are saying they actually went on the website and they registered, and they received an SMS saying that they registered, but they weren't issued with a voucher number. Can they just show up here and then?
Yes, they can, because we have people that do verification. Immediately when they come, they will request their ID number. With the ID number, it's very easy for them so that they can see if they are on the system. If they are not on the system, then we can register them immediately. But besides here, we also go to our old age homes, and we have a couple of old age homes within our district. So we have done majority of them. I think by Monday will all be completed. But we don't only go there without the approval. We need approval from the families. Remember, it's old people who are staying there, so we need to get approval, a confirmation to say I do agree that my mother can be vaccinated. Remember that it's voluntary. Nobody is forced to vaccinate. You can do it on your own will. Nobody forces you to do that.
How many venues in this Sedibeng district are you doing vaccinations at?
Okay, we started the rollout. It's 2 weeks now that we have started. Ne? The first one is here, Johan Haynes CHC. The second one is Levi Mbata in Everton, which is also a CHC. Remember, we have medical sites and non-medical sites. So we also have Mafatsan in Everton. It's a non-medical site. When we say medical site, we talk about clinics that are already operating. So non-medical site, we assess them to check if there's water, there's electricity. So the first one is Mafatsane, which we enrolled also this week. Ne? So we have Ratanda multipurpose, is in Heidelberg. So enrollment started as well. And we have started with Sharville Clinic as well. And today we are launching Merton CHC. It will be a vaccination site as well. Besides old age homes that we visited, which we regard them as non-medical site because it's not a proper clinic. So yeah, those are the sites at the moment. But as the roll plan goes over, then we'll definitely open more sites.
How long does the second phase of the vaccination last, where they target people 60 years and over?
We were looking by June, we should be finished with 60 years and above. Because remember, we need to still get to the second phase, which is 2B, because already we are doing 1B now. We need to look at other phases like our teachers, our police, things like that. But beside that, we do vaccinate teachers which are 6 years and above. Not only teachers, everybody that works for the government and our community which are 6 years and above.
Okay. How are the numbers looking? Are you getting enough people coming, or would you like to see more, or haven't you assessed the numbers yet?
No, we have assessed. At the moment, we have vaccinated more than 6,000 in Sedibeng district. But looking at the numbers, we are expecting to see more. Because even with our traditional practitioners, we haven't seen much, but we're hoping to see more. Like every day we do get a roster to say which leaders are coming within our district. We have vaccinated our mayor, our executive mayor, Ndade Moerane, and also our speaker, Mayor Tsokodibane, and also our councillors. If they come here, we need to profile them, because such things, we encourage the community to come and vaccinate, because vaccination saves lives. Morning, Dumelang. When they're done here, they line up here to go inside, and before they enter, they need to be sanitized.
So once they are being registered, then they will send them a message when they should come for the second dosage.
And how long after the first dose
It's
do people?
taking between 21 to 28 days.
Okay.
So normally what we do, we explain to them between that date, if they haven't received any message, they must come with this card, because it will be a proof that they need for a second dose, and that will be, by that time they are already being registered, they are well. So everything, it's not a, and then our card already doesn't matter, it stamps, so it's a proof.
Yes.
That everything it's been done, so they keep this, and then it will be a proof that they are fully vaccinated once dosage 1 and 2 it's been completed.
So with the Pfizer, you do need to take both vaccinations
Yes,
in
but
order
not for everyone, I
to
guess.
to be registered as fully vaccinated.
Yeah, but
You only get 2 doses if you were not, if you did not have COVID previously.
Okay.
But if you had previously had COVID,
You can get
contracted
away
COVID,
with
you only
one-
get one
one
because you
dose.
already developed antibodies.
I see.
My name is Mamkele Mzamani. I am a data capturer here at John Haynes. Actually, what we're doing here now is we're verifying the patient's details, like if they have a voucher, the appointment, also editing their information if it's correct and everything. If they have medical aid, like stuff like passport numbers, if they have passport numbers and IDs, and that's all.
Okay. What? So if a lot of people are saying, okay, now they're registered, but they don't have a voucher number, you'd be able to assist people like that to come here?
Oh yes, there are patients who come here who have been registered at all. We register them today, meaning they won't get an appointment. The voucher is like an appointment. Yes, if they didn't get an SMS, it's okay. But if they received an SMS confirming that they registered, then we will be able to pick up a voucher code for them here in the system. That's when we write it down on the cards.
Oh, I see.
Yes.
Okay. So people can even come here, even if they haven't yet registered.
Yes,
as
they
well.
can come.
And then they can register here and do everything here.
Hi, my name is Ria Boni Maje. I'm a clinical associate. So I'm basically the one who's overlooking things when the doctors are not here.
Okay. Tell me about this area.
Okay, this is our emergency setting. So in case there's any complication with our clients here, I'm the one who's going to be helping out.
You see what happens?
Okay. Sanitized.
Yes.
Then that will get our next patient.
Okay, Oshapa Lemoni.
Okay, I'm a professional nurse, Stevens Monama. I'm here as a vaccinator, so I'm vaccinating all the adults here. So, Renentate. Thank you.
I see every time you vaccinate someone, there's a couple of questions that is asked.
Yes.
Can you just
yes.
explain that to me?
First, it's screening. We ask them if maybe they're not experiencing any signs of COVID-19, maybe like coughing, maybe they're experiencing headache, or maybe if they are tired, or if there's maybe any pain or any symptom that is related to COVID-19. And then after that, we ask for comorbidities, meaning chronic conditions that patients can have, like diabetes, high blood, asthma, and others. And then after that, we tell them what to expect after vaccinating. Like maybe they can expect a bit of tiredness, headaches, pain in the injection site, redness there, can be a bit of swelling, and then that. And then after that, we advise them on the return date, on when to come back.
I did a first video on Tuesday morning about vaccinations happening at the Three Rivers Retirement Village, and some people watched the video and they said, but how can they inject people without gloves? Can you just explain that to us?
Oh, all right. Before they enter the center, pre-screening is done also, ne? Just to confirm if you're not a suspect. meaning whoever who's entering the center will be less of COVID-19 suspect and will be having also less symptoms. And then after that, we start by sanitizing first ourselves, then we administer the injections, and then we also sanitize ourselves after. And then we do that each and every patient, in between each and every patient.
Yes. And she said apparently gloves are...
Also gloves can also transfer the COVID-19. It can carry and can transfer to the next patient again. Because if you wear gloves and then maybe let's say example you're exposed to the COVID-19 virus, you just transfer it everywhere you touch, whatever that you touch.
Yeah.
So to also limit and minimize that, we thought that we know that if you don't use gloves, you always remember that you need to use the sanitizer.
And you sanitize after each and every shot. So.
Yes, each and every patient you have to sanitize.
Sanitizer is better than gloves, because with gloves every every client you need to remove your, so basically it's good for the clinicians, so let's leave that one for clinicians.
And then from here, after they vaccinate, they will go to the post-waiting area, whereby they will further, if maybe they have questions, they will further ask there. They will also have someone for health education, and then the post-waiting area is for us to examine them for 15 minutes for us to see how this vaccine that we have just administered and how it's treating them.
How long do they have to wait in the area?
15 minutes.
15 minutes after vaccination, just to see.
Yeah, just to see if there's anything wrong.
This is where you get your picture after being vaccinated to say I'm proudly vaccinated here at Sediban District Health. Thank you.